Good morning, good morning. This is Spirit Journey. Boy, I woke up early this morning. Been up now over an hour. It is April 27th, 2020, Monday morning at 4:06 a.m. Yeah, I have a lot on my mind. And now getting the anxiety that I'm feeling in the center of my chest. It's really something with health and everything. Things change. As you get older, or I should say, as time goes on, different experiences you start to feel in your body, your mind, everything. Just want to share with you. It's just like a rant. It's a concern. I want to just get it off my chest. Literally, I want to get it off my chest. Um, I see I'm very sensitive. I'm a sensitive soul. I care very much about people. And it seems like no matter how much you try to show that you care, that people don't care. I want to talk about some personal things, my experiences as it pertains to this whole crisis, this COVID-19. And you know, some YouTubers will not say the word COVID-19 or coronavirus. Those real big YouTubers, because they're cut into their profits. See, if you really care, you know, about certain issues, now you'll say it. Now there are different creative ways to say it, to write it in the description or title page, title of the YouTube video. Some are very creative, so they can get their point across. See, even that bugs me. And I had written a comment on this one YouTuber, very big YouTuber. And when the individual, and again, I'm not going to say any names or anything like that, but when they put out there that they don't care about money, the fact that they mention that and that in their description, there was nothing about, no, they didn't use the word, coronavirus or COVID-19, nor in the description. And then in the video, they say, oh, see, I said the word. And trying to, that they don't care about money and this and that. People care. He cares. Because everything within the video, in the description detail, they give a whole detail about all their commerce, all the social media that they're on, the different links, the products, everything was money driven. It's okay to be money driven, but just be honest about it. And I felt that he was being dishonest. And so my comment was, and I said it respectfully, that one day he will be brave, that he'll have the guts to put in the title page and in the description and really become liberated. And I also shared that at first I didn't want to, in past videos before this crisis, I was I thought to myself, hey, I notice when I say certain things that they demonetize. And so like one or two videos, I didn't put in what I really wanted to entitle it. And then I said to myself, how will I in the future be able to reference that one if I don't say what it's about? So I just give the name what it is. It is what it is. And if they're going to demonetize whatever, they're going to do it. And I see now that they really, I think it was yesterday or the day before yesterday, yeah, 2 days ago, I was putting up a video, and now they have this new category, this new, it's really about censoring your video or for the demonetization. They want to know upfront what is the language content, or is it violence, or all these things. Like they really care. And I said, wow, the only thing I see in that is about finding an excuse to control you, to control your content. That's what it's about. And I feel that with the COVID-19 or the coronavirus, see, they give two different names for the same thing. Oh well. It's all about censoring and controlling. And that's how I feel right now, that controlling what I do, and they're trying to control what I say and feel. I almost feel like it's something, there's a movie about this, about thought police, that they could arrest you if a thought, or if they perceive that in the future you're going to have a thought. Yeah, it's a movie like that. And I think that's what they call predictive programming, something like that. And that's what seems to be happening. So, well, anyway, what I really wanted to talk about with this, I mean, I just had to get that off my chest. It's just a thought that came in my mind, but really about the medical field. And like I said, I care about all humanity, but I feel an edge coming to me. I guess maybe now I'm learning not to be as afraid as I used to be, afraid of hurting somebody's feeling. Now, I don't want to hurt anybody's feeling, but I don't want them to hurt my feeling either. But like how society is treating one another, and the field of medicine, it's awful. There's a lack of respect for modern medicine and even family as it pertains to health. So let me tell you, like, as many of you know who's been following my channel, Spirit Journey, I was in the military. I'm a veteran. And I go primarily now to the VA hospital in the city that I live in for a big part of my medical treatment. I used to go, had private doctors outside, but insurance changed, and finance. I want to try to conserve my money. Things are expensive, especially if you have 3 little dogs like I do. It's expensive if you bring them to the doctors twice a year, just for dental alone. And then the other care, the shots and all that, the wellness, all that. But anyway, I know now. I know this is going to be sensitive for some people, and again, I know what it's like to have relatives in this 6-week pandemic death. I had let's see, three cousins who died. Two of them, they were said to have had COVID. The other one, I don't know, but uh, that was a concern. Um, one is two are recuperating from COVID. So that's like that's five people. You have five. Let's see. Um, just make sure. Okay. You have three that have passed and two recuperating, and it put a lot of stress on me. Um, so I'm not here to try to minimize the seriousness of this virus. I personally feel that it's something more to it, and that people get the flu, people get colds, we're all getting older, and the statistics that are being kept, it's not really showing that there was any difference from last year to this year with the amount of people who allegedly died. But now it's being said that um, that they'll say that you died of COVID, when actuality you didn't. You could have had a heart attack. You could have had diabetes. So the things that you were classified of dying with last year, this year, 2020, is different. So the numbers, they are artificially making it worse than it is. Yes, people are dying. And I think fear could kill people. And I'm wondering whether that one family, not family, relative of mine who did pass away, whether they died of fear. Because they called their doctor. They said they're having trouble breathing. The doctor said, oh, it was just anxiety. And that Monday she was found dead in her home. So I'm wondering whether fear got to her and killed her. Fear could do that. And I saw that I was getting fearful. And the funny feeling in the center of my chest, because it's fear. And then I started coughing 2 days ago. I was drinking something and it made me cough. And then throughout the day after that, my throat was irritated. And then fear set in again. And then I started to get pain in my temples. I said, please, 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 Creator, please don't give me this. I don't want this this virus. And I had gone and got as a backup, I got this steamer so I could put my essential oils to alleviate, symptoms, whatever. And then it went away. I think it's all psychological, personally. But anyway, the medical field, as I was saying, I am a vet, and I would say the past, especially 8 years, the medical field, medical practices in New York City was horrible, horrible, horrible. I've had these really bad experiences with doctors, and it's like with the VA. I've been going there since the 1990s, and initially it was just okay. And then it started changing, and the people started, the staff, the medical practitioners were getting rude. It wasn't a pleasant experience. And so I went to private place after that. One time I had to call an ambulance, course, I wasn't feeling well. I was scared. This was some time ago, 10 years ago, I think this was. Yeah, and get to the hospital. Well, for one, the EMS didn't want to carry, put me on the stretcher. They wanted you to walk. And another time when I had to go, um, I went a total of twice, I think, to the, the ambulance. And the second time, I could hardly walk. And they still insisted that I walk into the ambulance. It's like they don't want to exert themselves. The EMS people, what do you call it? Yeah, the EMS, I think they're called. And the nurses, when you get to the hospital, the first time, I was like my heart was beating erratic, and panic was setting in, and I don't have anybody with me, and I don't know these people in this hospital, and I asked for someone. I said, please, please, someone stay with me. Someone hold my hand. Yeah, I pleaded with them, and they didn't want to go, and I had to go a week later for another thing. It's really weird what's going on. And I know, and I realized back then it's all fear related. I had a lot going on back then. Um, yeah, I think it might have been 8 days later I had to go back. And when I go in, they bring me in, and the lady that I had asked to hold my hand, she said, "Oh, you again," just like that. And I could hear her. I said to myself, "What a bunch of..." Now the place, it wasn't busy. It wasn't like it was packed with people. It was very quiet, and I saw at that point the insensitivity of the people that work there. She's from a different background than myself. That might have been part of the problem. Um, you go to, oh, I had this other doctor, OBGYN, and she had made a mistake. And rather than telling me, she hides it, but the situation arose itself. I started bleeding. And I called. And then the doctor says, "Oh, what happened?" Oh, I have to back up a little bit. With the OBGYN, I had to go under anesthesia, a light anesthesia. And anytime they use anesthesia, they always like follow up the next day, just make sure no complications from the anesthesia, whatever. And they said, "Oh, well, by the way, the doctor had to use such and such in you." I said, "Oh, really?" So I said, "Okay. Thanks for letting me know." And then this thing started happening, and so I had to call the doctor. That's why I called, because something had resulted after the conversation, and the what the doctor had said was really. I'm thinking. I don't even want to repeat what she was saying, but it was very callous. And she was eating at the time, and it was really insensitive. And so these are some, I really don't want to get specific about some of the things, but it revealed an attitude, a disrespect, and again, you're paying them, at least the insurance is. But see, they don't care that they're getting your money, and that OBGYN was a private doctor, and so it's a lack of respect. In a nutshell, with all this, with the medical field, because I could just go on, but really what I'm getting at here, that this COVID-19 coronavirus is a wake-up call for all of us, a wake-up call for the medical field, because they're getting cocky. They're giving patients pharmaceuticals that they know that will, in the long run, cause them heart failure, liver failure, kidney failure. They want to hurry up because they want to go play golf, go to the Hamptons. So they might induce your labor, so they can do their thing. You may be, let's say, a so-called minority. You're on public assistance, and so they're going to treat you differently, not with humanity. They try to do as little as possible in the hospital. This one instance, a lady had surgery, and when you have surgery in your abdomen area, they in the morning, they have you stand up, and that the first standing up is the most difficult. The pain was excruciating, really. Wow. And then they put me in the middle of the room, and I just gotta go do. And she leave and closed the door behind her, and she had me in the center of the room. And I guess the pressure of when you do the initial standing of the day, and then you sit down, your bladder, you have to go to the bathroom. I couldn't get to there was no button or, to call her to come in to assist me, and anything. And it was urgent. And I didn't want to pee on myself. There was a garbage can right next to me. I grabbed it and did what I had to do in it. She comes in eventually, back in the room. It could have been a half an hour or hour later. I told her what happened, and that I didn't want her to close the door. She said, oh, well, I have to leave in 20 minutes. I'll let the next person clean it out. I'm going to leave it in here. And then walked out. And there were other things too. Some of the people, again, it's not a judgment about people's orientation. But you have surgery. You don't want anybody eroticizing you. Okay? And that's also what happened. Of the same gender. Okay? Whatever you like is your business. But you just having surgery and you do. I said, please. I was irritated with that thing. Lacking professionalism. They try to do as little as possible. Even what they call the nurse's assistant, they don't want to work. And that one was a perfect example. And I told a family member about the incident, and they called the hospital. Everybody's on the pins and needle. And the doctor that operated on me didn't even come to even visit me. But now she's embarrassed. So now she comes and you can tell that she was crying when she came in the room. Okay. When I was to leave that day, it was just to be an overnighter. My word got around that someone had called and exposed them what happened with the garbage pail and not having your physician to check up on you. It was a lot of other things too. They had, when you get the IV, they gave me several IVs, but they didn't check to make sure that, like I think it's called a catheter, for you to urinate. They didn't. It got plugged. and I wasn't excreted. I could have drowned in my own, you know, when your body doesn't drain out, they're giving you several IVs. You're supposed to be urine, because you have the catheter, and the urine come out. Well, it got blocked. They didn't check. See that's when they're sloppy. The workers getting very sloppy. They don't know. They don't want to work. They don't want to do anything. And when the word got out, what happened? The doctor on call when I was leaving, I started throwing up violently just before I had to leave. Rather than the doctor helping me, seeing all the vomit all over the place, she says, "Oh, I thought you couldn't walk." So evidently what she heard was that I was put in the middle of the room on a chair and left, and I was forced to urinate, go to the bathroom in the garbage pail. And, oh, well, you can walk now. Well, yeah, it was 6 hours later, after the fact. So so they want to try to get you in trouble and give you a bad reputation. And you're the patient, and you're the one that's paying for the damn thing, for paying for it. So I find that this whole thing is a wake-up call for everyone. In this case, medicine, the doctors, the nurses, the nurse practitioners, the nurse's aide, everybody. See, everybody can get sick. Everyone. You could be a high-end doctor. You can get sick. You could disrespect someone because maybe they weren't born with a gold spoon. Maybe they're on Medicaid. Maybe they're black. Okay. You're too important now. But now this thing levels everything out. And they have this thing in New York City at 7 o'clock in the evening that you applaud or you bang on dishes by the window to show thanks to people who serve in the medical field, which could be nice. But in New York City, they're horrible. Horrible. And I feel bad to say that, but I can't just pretend that everything was okay. It wasn't okay. And so I hopefully after all this that they'll be humbled. The medical field would see that, hey, be humble. Your job could be taken away like that. Your health could be taken away like that. I think about, I used to be, I went to school for nutrition. I had gotten my master's in nutrition. And before I graduated, I had, I guess sometimes I see now that you have to be careful about information you give out, health advice. People don't want to, if it's unsolicited, sometimes people care. And maybe you could come across like, Miss Know-it-all. And I don't want that. But I had information and I cared for this person. But the person recently told me something that was interesting. They said, because I was telling them that I had bought these things, with this COVID stuff. I bought this salt inhaler, someone recommended. I said, hey, that would be a good thing to have as a backup in case you need it. So essential oils that you can use for inhalation also, or to anoint yourself, that's supposed to have certain medicinal thing. Even certain diet things. They said, something, the person's telling me, you remind me of someone who was into they took all this stuff, all these nutraceuticals, all this and that, and the person is in bad shape. Something happened to them. They can't walk. I think their vision also. And I told them, thank you for telling me that. Because it is true that things could happen. If you're not careful, sometimes the things that a combination of things that you take could have bad outcomes. Taken separately is one thing. So it's reminding me, hey, don't get too confident. But I see that even though in the past I had helped this person, I had given them a nutrition plan to follow. And the person's health isn't better. I don't think they stayed on it. They're definitely not on it. This was many years ago. But it's interesting. You can refer to someone, like I found something over the internet, YouTube, a facility where they claimed that people's diabetes were erased, like someone was a type 1 diabetic. That is the worst. And the person I know is a type 2. And it got erased. They no longer have it. So they're no longer on medication. Now, diabetes medication causes a lot of problems. Being on insulin is like acid. When you're taking it like that, it eventually it destroys your body. People who are diabetics. And so when I learned about, hey, you could erase diabetes by your diet, and it's a clinic in the United States, and it's supposed to, I told them about it. But it's like they poo-poo it. And see, my family, but that it's prevalent. It's prevalent with in my circle of people who I know. And it's like they're brainwashed about who to trust, who to follow. So here, eating clean food, even the program that I watch, these people, the only thing that they were there for was just the food. I mean, nutrition. They ate organic food. And the people there at the facility, the clients, were complaining. And I just couldn't believe it. Their behavior. See, toxic food is addictive. And what was happening, they was having withdrawals from just eating clean food. The body was detoxing. You have people who rather go on pharmaceuticals, eat bad food, and continue eating the bad food. You tell them about a place that, hey, rather than go on some vacation to, in the Caribbean, go to this place and get cleaned out. Come back a new person. I don't understand it. And so this person who I told about that facility, and them telling me, well, you remind me of this person who's about this and that stuff, but now is a cripple and all this other stuff. It's a spirit of contempt towards me. And you know why I think, in part, why they're so contemptuous? Because I don't have to take any medication. I don't have high blood pressure. I don't have diabetes. What else? Cardiovascular, I don't have that. But all these other people have it. And you want to help them. And so, yeah, I'm not a doctor. See, that it's that attitude. When you want to encourage people, something, don't encourage them. If they come to you, and if they ask, you can provide it. I say also, become your own physician. But if you need help, get a good physician. See, I think health begins with the individual. Eating right, getting the right exercise, and yes, it is hard. But ultimately, you are your own healer. It's your body that's doing the healing. They can't do it for you. Right? So they want to control the whole industry of health. They want to control now, with this coronavirus, who could come in the hospital and when. Oh, it's going to be a video conference. And then when you go to the facility, there's hardly anybody there. When the last time I went to that doctor, I had an appointment last month in March, and it was empty as empty could be. So I don't know about this. I don't know what they're complaining about. These health facilities. I don't know what they're talking about. Again, that's only one place I went to. I don't know. I don't know about this. Yeah. This other person, they had to go to the hospital in Long Island. There weren't a lot of people there. And they don't want you to go in there because of you might be contagious. So I don't know. So what I'm getting at with this, see, they're controlling and they're doing what they're doing. They're not being really honest about what's going on. But you're going to need to go to the doctors when you do need a doctor, when you can't breathe well. Oh, you can't come. Oh, let's do a video conference. And that relative died, I told you about. So they are first letting you go to the doctor, and then they stop, and then they control it. Well, they might control so much that more deaths because you're not there. They let it get worse and worse, your condition. And then they finally say, okay, you could come now. It's really, I think, evil in nature. It's controlling. It's a whole control and power thing, to put power over the people. They get you with the insurance. They get you with your bill. Yeah, I told you about that they played with my bill for my veterinarian doctor for my dogs. I said, wow, this isn't what I thought medicine was like. I used to respect doctors. I held them at the highest level. So I know I didn't come in with a funky attitude against health practitioners. But now, over the years, I started seeing things and avoiding doctors, avoiding anything with the healthcare system because my experiences. And then you get people from other countries coming in. I know this is not an anti-foreigner, but I see that their attitudes towards you as an American and as a so-called minority American, and they look at you and they treat you a certain way, and they don't think I see how they're looking at me. This is a wake-up call, how people that you know that it's in your circle, medical fields, this was very revealing about human nature, our character. And I'm very sad about it. Yes, I say knowledge is power. Find out more about yourself, your health. And yes, use wisdom. If you need it, use it. You need a doctor, you find one. But I say, hey, be your own doctor. Learn your body. Learn what it likes or dislikes. Be good to yourself. So hoping all this, I stayed in this weekend. It was rainy and everything. But I want to do a good medicine to my lifestyle, to me, to respect my bodies, respect my feelings, and be honest. And so this journey of mine is also about being honest with my emotions and sharing it rather than it building up in my chest. Get it out, honey. Be honest with your feelings. Be respectful, yes. But this whole world is one big illusion. And things are going to be exposed. That's what I said. Things are being revealed. Stand your ground, folks. Those who also are on a spiritual journey, like myself, for the awakening. Try not getting too bitter, too disappointed. Yeah, I tell that to myself too. Yeah. Don't be too harsh on yourself and with life. It is what it is. But try to put a silver lining on things that, you have yourself. You have yourself. And to fully enjoy who you are, be proud of who you are, and have a wonderful life. I hope I made sense in all this. That this is a revelation, the revealing, the uncloaking about human nature and reality and family and friends. You get to see who really is behind you and who really wants to destroy you. But just make sure you don't destroy yourself, okay? So love yourself, treat yourself good, treat your pets well, and treat your neighbor and humanity well. Take care, guys, and enjoy the rest of your day. Signing off.